confidence in every child. With access to the latest educational software, learners are prepared for the digital age with confidence and creativity, empowering students with skills in and out of the classroom. Swimming is a life skill that is cardinal for survival. Our ballet programs teaches more than just dance. It installs grace, discipline, and expression. The heart of knowledge builds in our school library with a wide collection of fiction, non-fiction, reference material, and digital resources. Our school offers exciting and safe playground facilities for both ECE and primary students. Safety is our top priority, and our drivers are carefully selected for their professionalism and commitment to the well-being of our students. At Christ Life School, we believe education is not just about passing exams, it's about preparation. So, if you are looking for a school that feels like home, where your child will be known, loved, and challenged to reach their highest potential, then Christ Life School is the place.
Welcome to another edition of Community Health Talk, where we blend faith and knowledge to empower you with the tools on how to live a healthy and more abundant life. I am your host, Sophie, and today we are tackling a silent epidemic that's affecting millions in our communities: diabetes. And before we just divert into our main topic, we are not just talking about the symptoms and the science. We are inviting you into a conversation that connects spirit, body, and lifestyle. Joining me today, I have Dr. Kelvin Imakando, a respected health expert and passionate advocate of health. Together we explore how faith, food, and fitness can work hand in hand to prevent and manage diabetes, and how you and your family can make a meaningful, lasting changes. Good morning, Doc.
Good morning, Sophie. Thank you for having me. Good morning, viewers.
Thank you so much for coming to.
You're welcome.
We are glad to have you. Today we are talking about something that most people don't really understand, and they just say, oh no, it's sugar, it's sugar, it's sugar, and people think it's the actual sugar that we eat without knowing what's involved in, how it comes about, how it can be managed. And we are seeing that a lot of people out there are being affected with diabetes, and so it's so good to have you with us today, because I believe you are going to give more information to people out there so that they can understand what diabetes is all about. So thank you once more. Driving to our first question, Doc, I would just love you to explain to people what diabetes is all about and how it comes about.
Okay. Thank you for that important question. So I need to mention that diabetes is a very important condition. It's called a non-communicable disease, simply meaning it's a condition that you cannot necessarily transfer to another person, like infectious diseases, the way TB is. If I have TB, I'm coughing, and you're seated next to me, you might contact it. But for diabetes, it's not transferable in that manner. So simply, diabetes is just a disease of the endocrine system. So endocrine system is part of the human body system. So the endocrine system simply deals with the hormones. And when you look at diabetes, the hallmark or the hallmark of the disease simply lies in just uncontrolled sugar. So in our body we have an organ which is called the pancreas, and that pancreas is responsible for the production of a certain hormone which helps in regulating the sugars. So what happens in diabetes is that there isn't that regulation or that control of sugar. So ultimately what we tend to see is a person having high sugar in their blood. Yeah, in simple terms.
Thank you very much for that answer. Doc, we've heard of people say, no, there's diabetes 1, I believe it has different stages, and you find that most people will be asking which type of diabetes do you have. So would you love to shed more light on the different types of diabetes?
Okay, thank you for that question once again. So with diabetes, diabetes is just a general term. Like you have alluded, there are different types of diabetes. Yes, so broadly I would just talk about two types of diabetes, because those are the common diabetes that we tend to see in our health facilities. So we have type 1 diabetes and type 2 diabetes. So the main distinction between these two types of diabetes, like I mentioned in the introduction, in the build-up, is that what happens with someone who has diabetes is that there is an organ in our body. Every living person has that organ, which is called the pancreas. So that pancreas produces a hormone called insulin, right? So insulin is responsible for regulating the amount of sugars in our body. So with type 1 diabetes, the problem lies in the insulin not being produced by the pancreas. Okay. Then we have type 2 diabetes as well. So type 2 diabetes, this is just a type of diabetes where insulin is being produced, but there is resistance. So there are a lot of factors that are causing that resistance to occur. Yeah, so broadly, like I've said, two types of diabetes: type 1 diabetes and type 2, and there are other types of diabetes.
So which one is common in children? You find maybe a child could be 2 years and they have it. So which one is common when it comes to kids?
Okay, so commonly it's type 1 diabetes. Type 1 diabetes tends to occur more in the young population as compared to type 2 diabetes. Yes.
So in general, diabetes is not sugar as people say it is, where maybe you're just taking sugar and then you get to have diabetes. It's different from how people say it.
So like I mentioned, ultimately the result will be uncontrolled sugars in your bloodstream, in your blood. There'll be uncontrolled sugars in your blood, depending, regardless of whether you have type 1 diabetes or type 2 diabetes. The end result is that you have uncontrollable amount of sugar in your bloodstream. So you've talked about people mentioning that diabetes could be attributed to diet, which is true, but it's not necessarily true that if you take a lot of Coca-Cola, you take a lot of sugars, then you have diabetes. It is an interplay of a lot of factors.
Okay, so Doc, what are the early warnings and symptoms of diabetes that people should look for? Maybe they have a family member, or maybe just themselves. They can be able to tell, to say, oh, this is diabetes, because of the symptoms and the warnings that they are experiencing at that particular time. So what are some of the symptoms and the warnings that people can look for?
All right. So one can suspect to have diabetes when they experience excessive thirsty, where they tend to drink a lot of water. That's number one. Secondly, when they wake up a lot at night to urinate, if they frequently urinate, they go to the toilet to urinate, that's also another symptom of diabetes, a common symptom, right? The other one is excessive appetite. Excessive appetite, you're eating but you still want to eat, you're not satisfied. Yeah, basically those are the main symptoms that almost everyone who has diabetes tend to have, and there are others, such as blurry vision, and these other symptoms tend to occur when it has progressed. So they are more like the complications of diabetes. So others would tend to experience blurry vision, others would tend to experience the numbness of the feet, others would tend to experience, let's say they have a cut, a wound, that wound takes time to heal. Yeah.
It's actually good that you have been touched on the part of the wound, because I was about to go that side. But then you've talked about two important symptoms: appetite. We've got people that eat, and now so you can't tell whether it's normal appetite or maybe they are sick, or they are taking drugs, which is appetito. So does it mean that we should consider the people that we have in our household that eat too much that they could have diabetes?
Not necessarily, not entirely true, because when you are thinking of a diagnosis, let's say somebody comes to you, all right, especially me as a medical doctor, someone comes to my office and they complain about certain symptoms. In our field, we do not make, a diagnosis based on one symptom. So it is an interplay. We consider other symptoms. So saying that someone who has excessive appetite has diabetes, that's not entirely true. That's not entirely true. But people with diabetes tend to have excessive appetite. They eat frequently. Yeah.
So they eat small meals, but
excessive appetite, because we cannot define normal in terms of eating. There's not normal, but an individual will tell you, I think I'm eating too much. Okay, I think I'm eating too much. So it's not you as an observer to state or to determine that such an individual has an excessive appetite. It's not in your place. But an individual will tell you themselves, because they know their body. They know their body. They know how much they eat. And they're the best people to tell you.
Okay, so doctor, just to go back to the symptoms, we talk about the wounds taking time to heal. Why is it so that somebody with diabetes and they get to have these wounds for diabetes, they take so long to heal? Actually, some they don't even heal. They start small and gradually they're just expanding and expanding. What's the main cause of these sores not healing?
Okay. So there are a lot of factors that causes wounds not to heal, especially in people living with diabetes. Okay, so one of the factors is when your body is subjected to high levels of sugar. All right, so as a result of that, the high levels of sugar tend to cause damage in your blood vessels. So the blood vessels, these are just simply pipes that transmit blood to different organs in different parts of the body. All right, so if your body is subjected to high levels of sugar, it tends to destroy those pipes, the blood vessels. So as a result of that, they could be blocked. All right, blockage to especially our peripheries being the feet, the hands. Yes, and for a wound to heal, it needs enough blood supply. It needs enough blood, because blood carries a lot of substances which are good for our body. All right, oxygen, nutrients, and the like. So because of that, in explaining why wounds tend to take time to heal, it is as a result of it is as a result of the blood vessels which are damaged, and because they are damaged, they cannot provide that wound with the necessary nutrients that the wound needs for it to heal. Partly that. Yes. The other reason as to why people living with diabetes tend to have wounds that are long-standing is because diabetes as well tends to affect the nerves. All right. So the nerves are just simply what would tell you, especially if you hit yourself, you feel pain. So that is the nerves working. They're transmitting that information from the site to your brain. Understand? So with diabetes, sometimes it tends to destroy the nerves. So what happens is that if you have a wound, you will continue injuring yourself, and as a result you won't even know that you have a wound. It will be there, so you won't even take care of it. So those are some of the factors that tend to contribute to why wounds in people living with diabetes tend to stay longer.
Very interesting. Our viewers, you can send in your questions and your contributions. Dr. Kelvin Imakando is here to answer and give you the information that you are looking for. Doc, it's surprising that these conditions, that if we go back into the 90s, when our parents, the 80s, you find that such conditions were not even there. but it has become so common in our generation. So what could be the main reason to why we're having such conditions become so common in our communities? If we talk about diabetes, why has it become so common?
All right, so to correct you, I think it's not right to state that back in the days such cases were not there. They were there, it's just that maybe the reporting wasn't as extensive as it is right now. Okay, but I could also agree that, you know, the incidence, all right, the number of people who are living with diabetes compared to the past and now, the number has increased. Yes, so the reason that is partly due to our diet, you know, because we've adopted, you know, a sedentary lifestyle. All right, so it's about lifestyle and diet. In our previous discussion, when we talked about hypertension, I think I mentioned about the importance of diet, such as you know, highly processed food. So as a result of that, it tends to also contribute to the developing of diabetes. So diet has also played a key role. Right, even lifestyle has also played a key role. Sedentary lifestyle has also played a key role. Yes.
So my next question, what role does alcohol, if we talk about people that drink, and diet play in the prevention and management of diabetes? Because you find mostly people that have diabetes, they will be given kind of diet, the things that they are supposed to eat and not eat. Even when it comes to taking alcohol, they are told to stop. So what role does alcohol and diet play? Okay,
so I think I didn't do a good job in explaining diabetes and the types of diabetes, so you allow me just to like quickly just briefly, you know, talk about it once again. Like I mentioned, you know, diabetes is simply, you know, the result or the consequence of, if someone has diabetes, is that they'll have uncontrolled sugar in their body. Everyone needs to have a certain amount of sugar in their body, because our organs, you know, the brain needs the sugar, you know, the liver needs the sugar. All right, so our body, you know, functions in such a way that it controls our sugars. It should be within a certain limit. Okay, and what happens when you eat, our sugars tends to increase. So when our sugar levels increase in our body after a meal, we have this organ called the pancreas. So this pancreas produces a hormone called insulin. So insulin is responsible to regulate the amount of sugar. So if the sugar is high, insulin will be produced. And that insulin, what it will do, it will work on the sugar so that sugar enters into our cells. By doing that, it reduces the sugar levels. So in explaining the types of diabetes, there are two types. There is what we call type 1 diabetes and type 2 diabetes. The difference between these two types of diabetes is that in type 1, the problem is with the pancreas, the organ that is producing the insulin. That's where the problem is. So the problem is that it cannot produce the insulin. Okay, that's in type 1. It cannot produce the insulin due to a lot of reasons. Okay, then type 2, the pancreas is working, it is producing insulin, but there is resistance. All right, there is resistance. So I want to specifically talk about type 2 diabetes in relation to the question that you've asked. So there is resistance. So the main problem in type 2 diabetes is that there is resistance. So what is causing this resistance? Okay, so in type 2 diabetes, what is causing this resistance? Number one, it could be you know, what we call BMI. You know, BMI simply stands for body mass index. You know, we talk about, you know, someone being underweight. You know, we talk about someone being overweight. We talk about someone being is obese. All right, so BMI is what we use to determine if someone is underweight, all right, if someone is overweight, or if someone is an obese person. You understand? So it is, so when you are if you have a sedentary lifestyle, you eat highly processed food, you don't eat a well-balanced diet, as a result of that you tend to have a high BMI. And because you have a high BMI, that tends to cause insulin resistance. Okay, alcohol as well tends to, it tends to promote accumulation of fat. All right, it tends to destroy your liver. Your liver can also accumulate fat. So as a result of that, alcohol does play a role in diabetes in relation to the type 2 diabetes, but not necessarily in relation to the type 1 diabetes.
Interesting. Our viewers, you can still continue sending in your contributions and your questions. It's getting interesting. We'll take a short break and we'll be right back. Send in your contributions and your questions to the following numbers on MTN 0960741864, and you can also use the Airtel number, which is 0974578988, 0974578988. And we will read your comments and the doctor is going to answer your questions. Doc, we get back to our next question. You talked about diabetes 1 and diabetes 2, of which you mentioned to say the common one is it that diabetes 2 can also become so common in the family? Does it mean that it runs in genes? Is it genetically transmitted to the other people in the family? And how best can it be managed if I'm pregnant and I'm expecting and I'm a person who's got diabetes? How best can I prevent my child from getting it?
Okay, thank you for that very important question. Yes, you've mentioned something which is very important, that diabetes type 2 tends to run in the family, which is correct, which is true. Yes, so type 2 diabetes tends to run in the family. Yeah, so because it tends to run in the family, so there are specific genes that are at play, in causing this diabetes, which is type 2 diabetes. But I think for the sake of this discussion, I don't think it would be necessary for me to go deeper into the genes. Yeah, but I think I should mention, I think it is important that I mention that type 2 diabetes tends to run in the family. It has a more genetic predisposition as compared to type 1. Okay, it has more genetic predisposition. So what does this tell us? So if for instance, if I have diabetes, my brother might have diabetes as well. So it's about the numbers. So according to the numbers, it's about especially in twins, it's about 15%. Yeah, it's about 15%, but I will need to check about the numbers exactly. Yeah, but it tends to run in the family. And you also raised the question saying that, let's say if you're pregnant and you have diabetes, how can you prevent your unborn child in the future? How can you prevent them from having diabetes in the future? So because you're pregnant, your child, given that example, so your child is at risk of contracting diabetes, which is type 2 diabetes. So when I'm like right now, so we are more focusing on type 2 diabetes. So when I say diabetes, I am referring to type 2 diabetes. Okay, so in that given example, yes, your child is at risk of having diabetes, not contracting, but having diabetes in the future. But you can take some practical steps in avoiding that. All right, so the practical steps that can be taken in avoiding that is simply lifestyle modification. So when the baby is born, as the baby is growing, you ensure that the child, as the child is growing, the child is having a well-balanced diet. their lifestyle, they're not, they are into exercise, they do exercise, you encourage them to exercise, basically that lifestyle modification. So once you take care of that, the chances of your child having diabetes later in future will be reduced. Yes.
Okay, and actually I think you've answered my next question on practical steps that families can take to reduce diabetes in the family. But let's look at stress. Most people say stress can contribute to your condition. You might be sick of anything and people be like, don't be stressed. So how does stress become an impact on a person who's got diabetes?
So I do agree with you. Stress can play a role, all right, can play a role in someone having or developing diabetes, but it's not an independent factor. I think I'll emphasize on this, that it's not an independent factor, all right. There are a lot of factors that are playing. All right, there is genetic predisposition, like I mentioned in type 2 diabetes. There is genetic predisposition, and there is lifestyle. Okay, so with stress, people deal with stress differently. All right, so people deal with stress differently. So given this individual who has a genetic predisposition to type 2 diabetes, all right, and they are stressed, and some people tend to deal with stress in a manner that they tend to overeat. All right, so when they are overeating, and if they are working in an environment, or they're in a constant environment where they are subjected to that stress, they'll be overeating. And remember, one of the risk factors which I touched on is diet. That diet tends to play a role in type 2 diabetes. So having explained that, I think you're able to see that there is that interplay of stress. People, as a person who's living under stress with genetic predisposition, they tend to overeat. They have a high BMI, and they can eventually, develop type 2 diabetes.
Very interesting. Doc, I believe that you're a Christian, and we are going to touch a bit on the Christian part. So I just want to find out, what are some faith-based approaches that can be used to manage diabetes, or maybe manage stress, vice versa, diabetes? What are some approaches that people out there can use to manage stress?
Okay, so dwelling on stress, and in relation to one being a Christian, the Bible encourages us, the believers, not to be anxious for nothing. So if you are stressed, it is advisable to go and pray. And when you pray, God will hear you. Okay, so as a result of that, you are managing stress by prayer. So I believe you can use that combination of prayer, in order to deal with stress.
Very interesting. Our viewers, continue sending in your questions and your contributions on the following numbers: 0960741864. That's our MTN number, and you can send through Airtel, which is 0974578988. 0974578988. Thank you so much, Doc, for the amazing answers that you are giving, and I believe that people out there, they are learning, they are getting one or two things, because we just go to hospitals and they say, oh, you've got diabetes, or you've got hypertension, and you just go with the same mindset home, and you don't know how it comes about, how it can be prevented. And because we are fed with the fact that you have the medication, all you have to do is just take the medication, without knowing that other ways that have to be taken for you to actually manage that condition. And it's so good that we have you today, and you're helping a lot of people out there. My next question would be, what role can the church and faith communities play in promoting health and wellness, especially around diabetes? Because you find maybe a patient who's got diabetes and their legs are swelling, they can't move, they can't go to church, and so now they are prone just to stay home and do everything from there. So what role can the church and faith communities play when it comes to helping people with diabetes?
Okay, so the role that the church can play simply involves like this one, where you are sensitizing the church and the community. Initially it's the community, but indirectly we are also sensitizing the church. So activities such as this one in particular, that's one of the roles that the church can play, sensitization. And I also believe, where we have these ministries in the church, such as the women's ministries, such as the men's ministries, such as the youth ministries. I think it is also important to also not only just dwelling more on the spiritual teachings, which is very important, but we can also integrate such talks where you invite somebody, an expert, not really an expert, you can invite somebody who's a professional in the medical in the medical field. They give a talk based on the prevailing or the most common conditions like diabetes, which we talked about in our previous session, such as this topic that we are currently talking about, HIV and such ailments. So that's one of the roles that the church can take part. Firstly, and then the other thing that I need to mention, which is equally important, is forming supportive groups. Having groups. I know when dealing with health issues, people tend not to disclose that I'm battling this condition, which tends to be a challenge. Okay, but it will be very grateful, it will be very very progressive if people can come out, people that are battling with non-communicable diseases such as hypertension, such as diabetes. If they can come out and create supportive groups, where you share amongst, where they share amongst themselves, okay, this has been my journey, I saw this doctor, he recommended this, they encourage one another, not only in spiritual things, but equally in, matters dealing with health.
Very interesting. I think on the part of what role the church can play, I think we've seen in other churches where they can have health talks before the men's service, where they can present certain conditions and they teach people how to prevent them, attaching them to Christianity and how best they can continue believing in God. And I'm just going to take you a bit, Doc, on we talked about diet, and most of the times you come across people that have diabetes and they say, oh no, I can't eat white bread, I need to eat brown bread, I can't eat foods that have oil, I need to eat something that doesn't oil, even when it comes to salt. So how best, because I know there is someone out there who says, I can't stop eating white bread, I just have to eat what's available, because they can't manage to get the things that the hospital has taught them to do, so they will just adapt to the life that they have been living. So maybe can you just shed more light on the importance of adjusting to the diet that the hospital requires of us than the one that we desire to take?
Okay, thank you for that question. So you're simply talking about treatment. How do you treat someone who has diabetes? So treatment of diabetes does not only involve prescribing drugs. It doesn't only involve that. Right? There's another aspect, which is lifestyle modification. There's also diet modification. So like I earlier mentioned, people living with diabetes or someone who has diabetes, the main problem is with insulin, either insulin resistance or insulin production. Right? So these foods, like white bread, once you eat that food, it tends to spike your sugar levels, and because you don't have that, you know, hormone, which is insulin, to help you reduce that sugar. You know, so we encourage, you know, people living with diabetes to be eating, you know, complex, what we call complex carbohydrates. So complex carbohydrates, these are just, you know, the food that we eat, such as, you know, we have carbohydrates like potatoes are part of carbohydrates, you know, bread is part of carbohydrates, but we encourage people living with diabetes to be eating complex carbohydrates, you know, not processed carbohydrates like white bread. Okay, so part of the management we talk about is, you know, they shouldn't, you know, take, you know, sugar, you know, anything dealing with sugar like tea. If they're drinking tea, don't add sugar. Okay, if you're drinking tea, don't add sugar. Even honey. Surprisingly, people have this notion that honey is better than sugar, but it has been proven through studies that actually honey poses a greater risk compared to sugar. Apparently, yeah, according to studies. So it all goes back to diet. All right, so we encourage people living with diabetes to be, you know, having, if it's involving, you know, if it's involving carbohydrates, they should be having complex carbohydrates, you know, such as brown bread. Okay, not highly processed food like, you know, the chips that we eat at our fast food outlets. I don't want to mention the names, but I believe the viewers know what I'm talking about. Yeah, you know, complex and carbonated drinks, those should be avoided. Those should be avoided because you are subjecting your body to the high sugars, and the high sugars, if you're not controlling it very well, complications will arise. So the key thing is just controlling your sugar levels. And how can you control your sugar levels is not only through medication but also through diet. Okay, also through diet, by what I've just mentioned. Yes, so white bread should be avoided, or should not be taken at all. You know, sugar should not be taken at all. Honey should not be taken at all. These drinks, you know, the 100%, they should not be taken at all. Better, if you want something sweet, grab a fruit, grab an orange, grab an apple, eat a banana. That's okay. That's okay.
Isn't it that some certain fruits also contribute to someone with diabetes to have a very high levels of sugar?
Yes, they can. Some food can. Yes.
So which means even fruits are not every fruit can be taken.
Not every fruits are good for your body because they have been given by God. Fruits are good. Actually, someone with diabetes should be encouraged to eat fruits, a lot of vegetables. They are good. Yes, they might increase your sugar levels, but the extent, the amount, the quantity, will be different from if you eat these other types of food like the white bread that we've been talking about, because they're highly processed. Yes.
Thank you very much, Doc. I hope our viewers, you are getting one or two things. It's getting interesting here, and a lot of information is being given out there. Continue sending in your questions and your contributions, because I believe every information that is being given out here from our doc is helping someone out there. You might know a person who's got diabetes, or it might be yourself who is suffering from it. Please do get one or two things. You've heard what you're supposed to do and what you are not supposed to do. So hope you are being helped, and you are also helping somebody out there. Doc, I've just remembered that hypertension and diabetes normally move together. You find a person that it's so rare to find someone who has diabetes not having hypertension. It's very rare. So you find if they have diabetes, then they also have hypertension. So how possible? I just want to understand the science here. Why is it that diabetes and hypertension move together? Like they are just so close. It's more like it's husband and wife. They move together all the time. It's, I don't know, maybe 1% from people that maybe just suffer from diabetes without having hypertension, or maybe they're suffering from hypertension and they don't have diabetes.
All right, yeah, thank you for that question. Yeah, so most commonly, people living with diabetes tend to also suffer from hypertension. It's true. There are quite a lot of people that are in that bracket group. Yeah. But concerning the exact numbers, I'm not really sure. I'll have to check it up. Yes, so yeah, it is true that people living with diabetes tend to have hypertension. So one of the reasons, or how we can explain this from the scientific background, is if you are paying attention, and the viewers, I believe they were paying attention, when we discussed hypertension and now discussing diabetes, I mentioned something that has been consistent in both sessions, and this is lifestyle. Oh, yeah. I've emphasized on lifestyle and diet. So if you look at the risk factors of diabetes and hypertension, they're almost the same. Yeah. So as a result of this, I think that's the reason why, you know, people living with diabetes tend to have hypertension, partly due to the lifestyle, because lifestyle and diet tends to contribute to the developing of both diseases. Yes. Very
interesting. And so now, if we get to the part of medication, you find that if I'm suffering from diabetes and I have hypertension, I'm supposed to take all the drugs for hypertension and diabetes, and most people say no, these drugs can cause damage to the liver. So does it mean that these medications that people are given when they are suffering from hypertension and diabetes do not really have those side effects that would cause harm to the liver inside?
All right, so thank you for that very wonderful, excellent question. You've talked about side effects, so, and just to correct you, because we are live, so these drugs don't tend to destroy the liver. Yeah. So the antihypertensive drugs, or because you haven't mentioned, so I'm just trying to correct you that in case somebody might, you know, think like, you know, drugs that are used to treat diabetes cause damage to the liver. That's not entirely true. Yeah, so like any other drug, whether as simple as even paracetamol, which is Panadol, you know, Panadol, diclofenac, you know, such drugs, they all have side effects. So every drug has a side effect. But what we tend to look at is what are the benefits. Okay, we have this individual who's suffering from a certain disease, okay, and we have this drug that we can give. All right, we have this drug that we can give to this individual. So we look at the benefit. What is the adverse effects if we don't give this drug to this person who's suffering from diabetes? What will be the effects? What will be the complications? So we look at the benefits and the risk. Okay, and in most cases, the benefit outweighs the risk. So you're better off, you know, you're better off benefiting from that drug. Yeah, so there is that aspect. Okay, and the other thing is the studies, because these drugs have been extensively studied. So there is data, all right, there is some data that is there that has been published, you know, explaining the risk. Okay, so maybe for instance a certain drug will pose risk to the kidneys. All right, there is data, and it will tell you that okay, maybe 1% of the population who are taking this drug will experience such an effect. So what does that tell you? Let's say in a group of 100 people, only one person will have an adverse effect. So if you look at the benefits and the risk, is it more beneficial to give that drug, or it is risky? So looking at that example, I think both you and I can agree that it is more beneficial if we give that drug. So all in all, or in conclusion, I should mention that, you know, every drug has a side effect. But what we look at is, number one, is this drug, the benefits, are they outweighing the risk? That's number one. Secondly, what we tend to look at is the comorbidities. All right, we will not just give you any drug. Another thing that we'll consider is the comorbidities, okay, because these drugs tend to, interact differently in our bodies. Like you've said, you might have diabetes, you might have hypertension at the same time. If we give you this drug, is it good for you? In someone who has both diabetes and hypertension, it's different from another individual who has maybe diabetes only. So we look at all those factors. Yes, I hope I've answered your question.
No, you have talk. I know most of the times we get to diagnose ourselves, maybe because you have a BP machine in the house, you've got the test kits for sugar, and maybe that morning you wake up and you check your sugar levels, you find that they are high, and you're like, oh, I have diabetes. I don't think there's a need to go to the hospital, so let me just go by the pharmacy and get the drugs that I'm supposed to get, because they are scared, knowing the fact that when they visit the hospital or the clinic, they will be told, okay, so you have to stop doing these things. And it's more like the don'ts become a lot and the do's a little, just a few of them. And so someone looks at them and say, I don't think I can manage. But Dr. Wani said, no, stop doing this, don't eat meat, no, don't do this, then they are doing it. So why should I visit the hospital? So what best advice would you give to the viewers out there on why it is so important to visit the hospital and not give ourselves a diagnosis because we are scared, we'll be told to stop doing the things that we love to do, forgetting that that's the best treatment that we can actually give ourselves so that we can be better people and have a better community.
Right. Yeah, thank you for that. You've reminded me of a certain post that I read on social media. It read something like, when someone has committed a crime, what do? They'll go to a lawyer. You understand? But it's different when an individual has a health problem. They don't go direct to a medical doctor. Others will go to see a pastor. Others will try herbs. Others will even go as far as visiting a witch doctor. It's different. I don't know the reason why, but I need to encourage the viewers that whenever they experience a change in their body, they feel different from how they normally feel, it is very important to visit a hospital. I need to emphasize on this. It is important to visit the hospital because when you visit a hospital, you are guaranteed of certain things, such as finding someone who's qualified to attend to you, someone who understands your body. Okay, you've talked about people having BP machines at home, and I also encourage for every viewer to have a BP machine at home. It is good, it is important that once in a while they take measurements of their BP. It is very important. Okay, so those individuals, those people that have a BP machine and the like, and they tend to test and they see, okay, it's high. They Google what drug can I take to help my BP, and I go by the pharmacy. That is not advised. Instead, I advise people, I encourage people to visit any near healthcare facilities, because they are assured, they are guaranteed of having a qualified medical practitioner attending to them, because those people have studied and they know what really goes on in the body. All right, so what am I trying to get at? What I'm trying to get at is making a diagnosis, all right, of even just high BP. It's just about numbers, right? If your BP is greater than this, then you have BP. It's not necessarily that. All right, there are other things, there are other factors that we need to take into consideration, which you as an individual, because you haven't really been in a class, okay, to be taught about such things, all right, you overlook them.
No, very true.
You overlook them. That's why it is important to visit a healthcare facility, because those people are well qualified and they'll be able to accurately, all right, accurately make a diagnosis and prescribe the right medication, because it's not everyone who needs a certain drug. There are other things that need to be taken into consideration, such as age, such as sex, whether you're female or male, such as, maybe are you in the reproductive, age group, or are you married? Because all these drugs tend to, affect, the lot of systems, reproductive system, your liver, like you mentioned, so it is important that they visit a healthcare facility. In as much as, people don't like to be told, don't do this, don't do that. Yeah, too much of everything is bad. All right, too much of everything is bad, but the main message is not, do not take this, do not take that. It's about moderation. All right. Salt is good. Salt contains what we call sodium chloride. Sodium is good for your body. Your body requires sodium. Okay, so when we say, it's not necessarily like, do not take salt. What we are preaching is in moderation. All right, in moderation. Meat is also good because it contains iron. All right, it's good for your muscles. Okay, but we are not saying stop eating meat. Yeah. What we are saying is moderation. All right, and it's all depending on what we are looking at. Are you suffering from diabetes? Are you suffering from hypertension? All right, so it's all about moderation. Everything is good, but it's about moderation. So the main message is that to the viewers is that when you go to the hospital, don't go to the hospital with the mindset of they're going to tell me stop doing this, stop doing that. No, it's about moderation. But the challenge is, will you be able to adhere to that moderation? It's a challenge for most of the people. So what's the best thing to say? Don't. If you can't control yourself, if you don't have the discipline, you lack the you lack discipline, then don't. Yes.
Interesting. Our viewers, you have heard, don't give yourselves a diagnosis. Visit the hospital, visit the clinic, and let them do the right thing that is supposed to be done. Don't go to the pharmacy and say, oh no, nakwata diabetes because nachipima sugar ili high. You ask for medication. No, let the doctors do their work. Doc, I have just seen a comment, a very interesting comment. Someone is asking to say, is it okay for someone with diabetes to fast?
Yeah, so thank you for that important question in relation to whether people living with diabetes can be encouraged to fast. So first I want to make mention that it's dependent on the type of diabetes that they have. Okay, so if it's type 1, they are not really encouraged to fast, but those with type 2 can be allowed to fast. Okay, they can be allowed to fast, and it's not only just dependent on the type of diabetes, it's also dependent on the drugs that they're on. Okay, it's also dependent on the drugs that they're on, because remember, we've just talked about diabetes. We haven't really talked about what treatments are available for people living with diabetes, whether is it those that have type 1 diabetes or those that have type 2 diabetes. We haven't really talked about that. Yeah, but I should make mention that people living with type 2 diabetes can be allowed to fast. Can be allowed to fast depending on, number one, the medication that they are on, because there are certain medications that tend to sensitize your pancreas. Remember the pancreas we talked about? Yeah, they tend to sensitize the pancreas, and the pancreas will now produce insulin. So when it produces insulin and then they haven't eaten, what will happen? Their sugar levels will drop. And a low sugar is actually more dangerous than high sugar. So it's dependent on a lot of factors, being number one, the type of diabetes, and secondly, the medication.
So is it possible that they can maybe fast for 1 week, 2 weeks?
Okay, I can see you're emphasizing on the time frame.
Because I know there are people out there they'll be like, no, but Papa knows that they fast for 1 month, and this is a person who's got diabetes, so, and they're on drugs. So I believe they need the information to know what's at risk if they go that long fasting and they are not taking proper food that they are supposed to take at that particular time?
Yeah, so from the health point of view, fasting for as long as a month for people living with diabetes is not encouraged. They can have intermittent fasting, let's say 6 hours, they break, such is encouraged. Yeah, but again, like I mentioned, it's dependent on the type and the medications.
Okay, very interesting. Our viewers, I hope you are learning one or two things, because the information that Doc has given so far is very, very, very important, and you need to take notes. You need to sit down with your family, share this information, let them learn one or two things. Doc, it's a very interesting topic, and it just opens up the minds of people. And I know there's someone who's wondering there and seated to say, okay, so Doc has explained what diabetes is, how it can be managed, but let's talk about affordable food that can be accessed by people that are in, let's say, maybe in the communities. They're not maybe living that good life, they're struggling, it's surviving. The monies that they make, they have to survive on it, and there's this diet that has been given to them, and now they are looking at the means they will use to get that thing they have been told to get. And so for them, they will be like, okay, I think what's available, we can't manage to spend money, because the hospital has said, oh no, you can't eat cooking oil, you need to start using olive oil, no, you can't use this, you need to start using sea salt, pink salt, because these are things that people use now. They'll be like, oh no, sea salt, I was advised to use sea salt. And people say diet is expensive. It's very expensive. You have to be stable to reach the standards. So what's the best foods that people out there can access and they can afford when it comes to managing diabetes?
Yeah, I agree with you. I think equally in my interaction with patients, especially those that are living with diabetes, one of the challenging factors that has consistently come out is the financial status, socioeconomic status of most people. Is that they tend to default from the recommended diet that they need to be taking from every day. All right, they tend to default from that, and it's so unfortunate. Because diet plays a key role in managing diabetes, in as much as medications, taking your medications, in as much as it is important, that also plays a key role in managing diabetes. And it's so unfortunate. It's so unfortunate. So in terms of how communities can be helped, it's a tricky question to answer. But from a health point of view, I'll emphasize on diet modification, that it is important. But there is little that can be done. Maybe we need to look at what available foodstuffs that are available, which are cheaper. Maybe we can look at that. Maybe that's the best way we can try to help such people. And I believe there are some food that are available. If you talk about porridge, we can encourage people to eat porridge. Porridge coming from sorghum, porridge coming from sorghum, porridge coming from millet. Maybe they can be encouraged to take such. But it's so unfortunate. It's so unfortunate that people have to go through that, because in the past diabetes was called the rich man's disease, because it had to deal with, because not everyone could afford sugar. But we're seeing a lot of cases rising, and
Thank you very much, Doc. Taking you to our last question before we close. We have many people that are struggling with diabetes, burnout, and some they just say, I can't manage doing these rechecks, because they are given time to say, oh, when it's 12 you have to check, when it's at this hour you have to check, and they've just reached that point where I'm like, you know what happens. So what's how can they stay motivated? And not being my last question would be, what best advice or what message of hope can you give to people out there who are living with diabetes and they want to give up on the medication? They just want to stay and hope that a miracle will take place.
All right, thank you for those important questions. So apparently, you know, conditions such as hypertension and diabetes are chronic conditions. So chronic simply meaning it's a lifelong condition that one is expected to live with, you know. And since it is a lifelong condition, one has to invest in it, you know. Same applies to if you are a school-going child, you're taking mathematics, and at your level if there are some complex, calculations that you cannot, perform, you need a calculator. So a calculator becomes an investment that you need to, you'll be expected to buy a calculator, because without that calculator, you'll not be able to, make those necessary calculations. So even with people living with diabetes, they have to, it is advisable that they invest in, buying a BP machine if they also have hypertension, and buying the what we call the glucometer. So a glucometer is just simply a machine that is used to measure, one's sugar levels. So I don't know how we can work around it, but it's advisable that they can, they should buy that. They should buy that because it is an investment in their own health. And if there are people, other stakeholders like, NGOs, even churches, if they can identify people within the congregation that are suffering from diabetes rather, and they cannot afford, they can identify such people and help them, by just buying these basics. And my message to the viewers is that yes, in as much as I've mentioned that diabetes is a lifelong condition, but it is manageable. It is manageable if they adhere to their medical advice, the practitioner's advice. If the medical practitioner that has been seeing them, if they've advised them, not to take certain things, they should adhere to such advice. So that's my message to the viewers. Secondly, since it is a lifelong disease, it's a lifelong condition, it has to be managed. They should also, we are lucky, like in our country, Zambia, where you can easily walk to a hospital and you'll be seen by doctors for free. Other developed countries, you need to have insurance, you need to have money, but I believe most hospitals, you can be seen, for free. So people shouldn't be worried about, the money for checkups and whatnot, because most public hospitals are available for patients, for such people that are living with hypertension, to be seen.
Thank you so much, Doc, for coming through, and thank you for giving out the information to our viewers. I believe they have heard or they have learned one or two things. To our viewers, hope you had grabbed your notebook, you gathered your loved ones, and you stepped into this journey with hope, healing, and transformation. From me and my crew, it's bye-bye. See you next week.
Christ Life is more than a school. It's a nurturing community. Our qualified teachers use innovative methods that keep the minds and hearts of our students engaged. Our cafeteria isn't just a place to eat. It's a hub of nourishment and community. Our sports activities are always filled with fun and creativity that promote teamwork and confidence in every child. With access to the latest educational software, learners are prepared for the digital age with confidence and creativity, empowering students with skills in and out of the classroom. Swimming is a life skill that is cardinal for survival. Our ballet programs teaches more than just dance. It installs grace, discipline, and expression. The heart of knowledge builds in our school library with a wide collection of fiction, non-fiction, reference material, and digital resources. Our school offers exciting and safe playground facilities for both ECE and primary students. Safety is our top priority, and our drivers are carefully selected for their professionalism and commitment to the well-being of our students. At Christ Life School, we believe education is not just about passing exams, it's about preparation. So, if you are looking for a school that feels like home, where your child will be known, loved, and challenged to reach their highest potential, then Christ Life School is the place.